I want to talk about the antivirals. I think a lot of people, myself included, really hoping that, these pills could be a game changer to have a real treatment. But taking a look at the vote, it was really narrow approval.
Yeah, I live in Philadelphia where, Ben Franklin famously said an ounce of prevention is worth a pound of cure, and that's certainly true here. At the beginning of illness, the virus reproduces itself hundreds of times, thousands of times, and then your immune response kicks in. And with that, then you get symptoms. That's when you get symptoms. And as you get symptoms, then the virus reproduces itself less and less and less. Antivirals, monoclonal antibodies are only going to work at a stage where viral replication is an important part of the disease process, which is early on. So that's when you would have to give it. Really, once you're in the hospital, it's too late. So we don't give antivirals in the hospital for the most part, unless children have been infected for symptomatic for really fewer than just a couple days. So I think that the game changer here is not antivirals. The game changer was vaccines, and it's been very hard to watch people choose not to accept that game changer. This ticket out of the pandemic is the vaccine, and watching people reject it is just, for me, frankly, impossible to believe.
Now, do you think those monoclonal antibodies will need to be tweaked or changed in any way because of, Omicron or other variants that, pop up that are variants of concern?
Yeah, so the way a monoclonal antibody works, mono, single, meaning it's directed against just one so-called epitope. An epitope is an immunologically distinct region on a protein, and that's what monoclonal antibodies do. So as you get mutations, a mutation might affect that one particular epitope, in which case the monoclonal antibody wouldn't work. So you're right, you would not need to constantly be making new monoclonals against different immunologically distinct regions. That's where monoclonal antibodies, that's the biggest weakness of monoclonal antibodies.
All right, a lot of people right now looking forward to a holiday season and gathering together, most likely indoors in the tri-state area. It's very cold outside. So how do we decide whether or not it's safe and, how many people can gather together and when to test?
No, I think, first of all, we have a vaccine. I think, I was part of a party the other day with about 40 people. Everyone in that room was vaccinated. And for that reason, I felt comfortable not wearing a mask. But if I was in a room and I didn't know whether people were vaccinated, I wouldn't feel comfortable. And so I would wear a mask. I think if you're vaccinated and you don't have symptoms, I think you can feel comfortable that you're not going to be transmitting the virus. Because I think it's a very low chance of that happening. On the other hand, this is a winter virus. We're going to be inside where transmission is going to be easier, and where you have groups that either can't be vaccinated because they're too young, or they can't be vaccinated because they have a severe immune dysfunction. We need to protect those people. So get vaccinated. This is really so easy. I don't know why we make this so much harder than it needs to be.
Do you think